Now, I bet you thought that the increasing level of veterinary healthcare available to your dog is a good thing. The reality, though, is that for many dogs and cats, it is actually resulting in worse care and even early death. Let me explain. So the standard of care is increasing rapidly, and what was the best care just 10 years ago may be significantly inferior to the best care, that gold standard, ideal care that is available now. But in many cases, the difference in the diagnostic ability and the subsequent treatment options may actually only represent a relatively small increase in a patient's general health and well-being, and across the whole population. For those dogs that are suffering from some really rare things, then this increase is going to be invaluable, but that is not the general picture. So while we might be able to also more accurately or specifically make a diagnosis, in many cases the treatment might actually remain the same. Equally, we might be able to provide a different treatment, supposedly superior treatment, but the prognosis or the life expectancy or the quality of life of that individual suffering from that condition remains, pretty much the same, or the difference really is not what most of us, most of you, would consider to be truly significant. What has changed significantly in many cases is the cost of providing this new gold standard care. Unaffordable, simply unaffordable for many people. And sure, insurance definitely helps, but as those bills climb, so does the cost of the insurance premium, and then that leads to the slippery slope of making insurance unaffordable, especially for our older pets, when the cost of the premium, just climbs, because that's when they're more likely to need more costly care. And then the demand and the expectation of the absolute top level care. It's also meant that conditions that would previously have been easily treated by the general practitioner, they're now routinely being referred to specialists because they are the only ones who maybe have that specialist equipment available to provide this new top level of care. But the result is that the GP vet is actually overall maybe losing skills that they would have had in the past to treat these more common conditions in ways that actually most of us would still consider to be perfectly acceptable. That being said, pet parents, they are becoming increasingly persistent in the desire to make that specific diagnosis, as well as to provide that top level care. And this diagnosis may actually compromise their ability to afford the subsequent treatment. So if we are concentrating so much on performing every single test under the sun, if we are wanting to rule out every single rare disease or rare injury that your pet could be suffering from, that comes with a significant bill. And if we're not able to actually afford the treatment that would be needed for whatever it is your pet's suffering from, then why are we pursuing that diagnostic pathway? And that is unfortunately a reality in many cases. There's also, and I've seen this in my years of being a vet, there's also an increased pressure on vets to provide nothing but the best care, or to not accept the limitations of a treatment plan. So it might be that a pet parent accepts that they're not able to, perform that blood test that, really is needed to make a diagnosis, or to undertake the x-rays or the ultrasound, for example. In failing to be able to do that, there are limitations to that in our knowledge. It may be that we don't know exactly what's going on, and so we can't be 100% certain. We can never really be 100% certain, but as much as possible that a treatment plan is the most appropriate thing, or we're not going to come across complications, or there'll be an increased risk of adverse reactions. And despite those limitations, if they're not accepted, it's very easy, and people are very quick to actually then blame the vet and complain if they fail to fix their pet with the imperfect information and the financial restrictions that are often. And unfortunately, the reality of this pressure on the veterinary staff, and that may very well not be you. The reality is that the vast majority of pet parents out there are perfectly reasonable, but it only takes the rotten apple to kind of spoil the whole barrel, if you like. And this increased pressure on veterinary staff as a whole, so on our vets, but also on our nurses and technicians, it's leading to an increased practice of what we call defensive medicine. So that's where we only want to undertake that gold standard investigative or treatment plan, or we want to run multiple tests just to be sure that that rare thing isn't missed, even when the likely diagnosis is staring at us in the face. And so how can you best determine what the right option is for your dog? Should you undertake this complicated diagnostic and treatment plan, or actually is what was the best thing from 10 years ago still incredibly effective and perfectly justified today, albeit at a much lesser cost? And this is where informed consent comes in. And if you want to learn more about informed consent and how actually it's a minefield in itself, you need to check out this video linked on screen now. So tap on that video, I'll see you there. But until then, I'm veterinarian Dr. Alex. This is Our Pets Health, because they're family.